even if they don't have connection to the internet, they can still be reminded through text if they're able to just one-off log in and be able to give their details. It keeps all my players in order, it keeps all the stats there. There's lots of different websites that you have that kind of do things around sports and community sports, but it's really hard. This information is all in different places, and what Sport does is try to aggregate it all together so that you're able to basically be more efficient in organizing these things. The reason why I find Sport very interesting is because it's not just about a handy tool for someone like myself who's involved in coaching to keep organized and on top of things, but it actually is providing a tool that lets people know about what pitches or places they can actually play sport. So it's increasing awareness of public spaces that are available for people to use, increasing participation in grassroots sports. It kind of ticks all the boxes for getting communities together around activity. It's dead easy to use. They have a Facebook application, so it plugs into other social networks, and it's just a way of keeping everything together and making people's lives easier to do it. And that's one of the best things about using web-based things to organize things differently. It works the best when it's very simple and can feed into all of the other things people are using rather than kind of existing in its own right. A lot of the work I've done at SI Camp has been using technology to address social needs. And I thought I'd highlight for you one project now that has actually just received some funding from the NHS. This project is called Have a Go Heroes, and basically it's a platform for people to rally around people who are cared for and people who are caring for that person. So I remember when I was growing up, I had a next door neighbor called Elia, and we'd always go over, help shovel her snow. I'm from Canada, we've got lots of snow. I'd do things for her. In return, sometimes we'd get cake. Mostly we wouldn't, but we just went and shoveled out Elia. I find, especially now in London, I don't know my neighbors. My neighbors don't know me. You could live in your community and not actually know the people that live around you. And the geographical community is a bit disparate when you look at all of these growing online communities. Have a Go Heroes is about creating those relationships that you had or that you can remember from when communities were geographically based, where you knew your neighbors and where people could help you. So basically, the way the service works is a carer can nominate or deem a champion the person that they're caring for. So say they're caring for someone with a disability or an elderly person in their community, and they need a break, or they're going on holiday, or they're just really, really busy. What they can do is they can say, this week I need help with someone going to the post office, or here's my grocery list. Is there any way someone could give me a lift, or is there any way someone could pick up these things for me and I'll give you the money? So it's a way of rallying a community around both the person who's cared for and the carer in an online-based way, as well as they're looking into being able to do it through texting or through different kind of groups and feeding into existing social media. So it's really just a way of the community caring for each other. This has it can save the NHS lots of money because informal carers are a big part of the sector. And these are people that are caring for friends, family members, that sort of thing. The NHS ran a competition called the Bright Ideas Grant, and it ended at the end of March. And what it was the public could vote on the best ideas that they thought could really improve the care sector. And Have a Go Heroes received £10,000 from them to kind of pilot and test. So over the next 4 months, Have a Go Heroes will be piloted in different areas. All the learning will come out of it so they can see if this actually can work in communities and can be a way of supporting those who need help in a better way. Have a Go Heroes was also an idea from SI Camp Central and Eastern Europe. It was submitted by someone who was between Poland and the UK, and he cares for his grandmother. Something that I've seen a growing kind of market for, especially with the work I've been doing at Do the Green Thing, is communities bulk purchasing renewable energy. So when I talk about fundamental change, I'm thinking about not just ways that you can change how your public services work or things. I'm talking about you could potentially change the entire market by doing something like this. So we've got the Carbon Co-op, which exists out of Manchester. It was a previous SI Camp idea. There's also little ones kind of in places around the world. There's something called iBog in California. There's another one in Canada. Basically what it is communities purchasing renewable energy sources collectively and then monitoring, sharing, and using that within the area. It's quite a simple idea. Someone would say I purchase some solar panels for my house and it generates enough energy for me and then some. Then I can say to Rav, okay, you're my next door neighbor, I'll sell it to you for this rate, which is going to be a lot cheaper and better for the environment than what I'm getting from EDF, for example, right now. So communities can effectively take themselves off the centralized power grid and generate and monitor their own energy systems. And this is a very it's very quickly changing, and it could actually do a lot, not just for the impact it has on the environment, but for individual communities, especially rural areas, being able to be in control of how and where their energy comes from.
May I ask a question on that?
Yeah.
Is that to do with like communities sharing the renewable energy that they're generating, or is it about them kind of buying renewable energy in bulk as a community and making savings that way?
It's both.
All right.
So you'll have communities that invest in the energy, the actual renewable systems, and someone or a few households are delegated for sharing that energy. But you also have examples where they get it from other sources, so they get renewables from, say in Canada, you'd get hydropower, and you would then be able to share that out. So it's completely deregulating the energy market in a lot of different places, and there are quite a few hybrid models based on this. The Carbon Co-op, the UK-based one in Manchester, is specifically about purchasing. So it's about communities sharing the cost for, say, a wind turbine that powers a 1 mile radius of a group of houses. Another thing that I've spent a lot of time working on at Social Innovation Camp is how technology has the ability to influence public services and how these services are delivered and how people are able to communicate the impact of these services on their lives. So 2 examples, one of which is an SI Camp project and the other one is not. My Police came out of SI Camp Scotland, and it's meant to be a feedback tool for the police. So the young woman who entered the idea said her idea was literally 82 words, which when you think about it isn't that much. But the idea was, my flat was burgled, it was an unpleasant experience, the police were great, I have no way of telling them, that's a shame. It gets a lot of flack because people always think people are going to put horrible stories up on it, saying, oh, the police are horrible, they're not doing this. But it also is a really good way of monitoring. So it's effectively a public feedback service for the police and how they're doing and what they're doing. And eventually this could turn into lots of different things. It could turn into a way of being able to map crime or map effectiveness of things based on all of the information you're getting from users using it. And My Police is actually modeled after something called Patient Opinion. And Patient Opinion is a feedback service for the NHS. Patient Opinion was started by a GP who decided that there's no way of any information getting to doctors. So if you had an experience with the doctor, you can actually provide feedback saying that was really helpful, that could have saved my life, or anything like that. So Patient Opinion is also a feedback service for the NHS. People can talk about their experiences, but what Patient Opinion does is make sure that the right people in the NHS are getting that information, and the NHS supports it and buys into seeing what kinds of things are being produced and what kind of information the community are giving about their local services. Now to talk about engaging with stakeholders and funders. Rav and I had a conversation about this before everyone came, but we were talking about sometimes how the way things are funded are broken, especially for small community social enterprises where